Let's do it live. We're going to go into the live demonstration with Dr. Emer. Bring him out and our patient.
Hello everybody. Thank you for being here today. I'm going to show you I'm very excited about this because it's one of the first fillers approved with the FDA indication of rejuvenation of the dorsal hands, and specifically volume in the hands. We have a wonderful patient here today who's very excited. She's never had a treatment before. And so I'm going to show you the on-label injection technique that's used. We're first going to clean, and I don't know if you guys can't see that up here, but we have a great candidate because she has some skin laxity and loss of volume, but she can see the veins and the tendons. And so our point is to sort of camouflage the tendons and the veins and also re-volumize this area. That is a sign of, as people age, you know, they look from their face down and you don't want your face beautiful, and then you shake someone's hand and they notice that the hands aren't as attractive, which gives away their age. So what we're going to do first is clean. And typically alcohol is really good. If you're using something like Hydroxylapatite, we have to mix this, it can get a little sticky. And if we're going to tent up the skin, you want it to be very dry. And so if you're going to use Hydroxylapatite, that would be great. You would do that first and then use alcohol to clean the area. We're going to do the injections between the knuckles and the wrist, particularly focusing on the area directly above the dorsal hand where we see the tendons. Perfect. So we've mixed the Radiesse with 0.26 cc's of 2% plain lidocaine. That's the on-label indication for numbing. And all we're going to do is I'm going to have you flex, squeeze your hand first so I can take a look at the location. Then bring your hand to flat and sort of flex it out. I can see where the tendons are. And so we're going to tent up the skin. And in the area we tent, the veins will go below. And all we do is do a little insertion, little pinch right there. And you do a little aliquot of between 0.2, and you can see it going in here, 0.2 and 0.5 of the medication. And as it goes in, it forms a little ball, and what we can do is do a light massage there to push the material around. And I focus on a light massage because I find that sometimes people are very sensitive to the dorsal hands, and if you do a very strong massage, they can get some more bruising. So now we'll go to the next little area, and area where we see the tendons. You feeling okay? Good. Major pain or no? Excellent. And we'll tent on the skin here, and the point is to look again for the area where the skin is tented, because that's where there is no vein. We do a little poke in that area, relax the skin, and you can see that the material just flows in there. Slow injection technique, because it will limit any complications that you have. Again, 0.2 to 0.5 of the material. And then we do a little depot injection, sort of massage it out. If you do it right next to the tendinous sheath, it will actually follow down the course of that tendon and fill in for you. So you don't need to do much of massaging or really extensive massaging. We'll go to the next one, let that settle a second. Squeeze your hand for a second, I just want to see.
So as Dr. Emer is doing this, is there any questions about the injection technique, the on-label injection technique that he is performing? Yes, sir.
Do you ever do the fingers? Do you ever do the fingers?
Do you do it on the fingers? Okay, so the question is, do you ever inject?
So the question was, do we ever inject into the finger? And you know, the on-label indication is dorsal hand between the knuckle and the wrist. In my personal practice, I do not inject that area. It's extremely thin, and some patients with a history of, and this is also the on-label history of Raynaud's or any autoimmune arthritis and things like that, it can affect that area. I wouldn't suggest doing that unless there was a reason. Go ahead and squeeze it. Just let's see. Perfect.
And I agree with that in my practice also. I don't generally inject the fingers. I stick to the dorsal aspect of the hand.
Okay, relax.
Any other questions?
Keep going. Find another area.
Very good. But we'll watch Dr. Emer do this. This is great.
You're doing great. Are you having much pain? So we're just following along the areas where we see need a little bit of volume. Have you mix in the rest from there into here. where we see it. When she squeezes her hand, now go ahead and squeeze. And just do light massage to get it over to the area that we want it. It's a viscous substance, but when some of the lidocaine is mixed in, it allows it to move a little bit better. And so now we'll keep fine tuning as we mix a little bit more. We've only done half of a syringe, and typically, go ahead.
Sorry, you can already see the difference. If you guys can see that on the screen, you can already see a nice difference from just what we've done.
And that's only a half. So we're going to start doing just a little bit more. And if you do the tenting properly, there's no real on-label indication of how you do that, but you can use your finger. However, there are forceps that are made that have little grappling ends that allow you to sort of pick up the skin so that you can see the tent very easily. And those are inexpensive and are neat. It makes it very simple to do the injections.
Great. We have one other question from the audience. Yes.
Almost there.
Okay. So the question is, if you already have pre-mixed Radiesse with lidocaine, Radiesse plus, are you when you mix it with lidocaine, decreasing the G prime? Would you do that?
Yeah, you know the indications to use the mixing kit. The Radiesse Plus is a powdered form of lidocaine, so the viscosity is almost no different, very close to the traditional viscosity of the regular Radiesse. And you want something to be able to freely move in this area, so it doesn't clump, especially if it's going to give volume. And so I would use the on-label indication of mixing in some additional lidocaine to make the G prime a little bit less.
And I agree with that. That's what I do as well. I try to thin out the product with, as is the on-label indication, with some lidocaine and perhaps a little bit better. And get that product to distribute nicely among veins and tendons.
Okay. So that was one syringe. Go ahead and make a fist. I'm just going to do very light. Now you can use a little bit of hyaluronic acid serum or light moisturizer to sort of even everything out, make it easier. I'm just going to do a light, more massaging. You do too aggressive massage can also lead to more bruising in that area.
When do you see these patients back in your office after you've done the procedure?
So I usually tell them 2 to 4 weeks, typically more like 2 to 3 would be better, just to make sure that there's no major swelling that's persisted. Can I see both hands just to take a look? Obviously you're going to have some swelling right now, but hold on. It's a little bit more spread so that we can see. So let me compare. Now flex your fingers up, and you can see the difference there. Obviously there's some swelling here, and it'll go down. Now what we're going to do is we'll do the other side. I'm going to have you take this hand in a fist. We'll put a little gauze on top, and I'm going to have her sit on that, or put it at least a little area of warmth so that the material sort of free flows. So you can put this maybe under your buttock or under your thigh. Okay? We'll sit on that, and we'll go to the next hand.
And that's a good point, is when you put warmth on the area, and it does help the product just kind of distribute out better.
Okay, so this is hand.
Like hand stretcher.
So we'll go again. So flex your fingers up so we can see all the tendons. Perfect. Okay, relax. So we're going to tent the skin again in this area. Do very slight. You don't need to enter far. Now, does that hurt when you even the first poke? And that's it. Perfect. So if you had to rate this on a 1 to 10, 2. That's great. So she's not really having much pain at all. And again, the bruising is limited by doing very little, very slow, small entrance site and tenting up of the skin with little depot injections.
Dr. how deep are you going?
So, you know, the hand obviously is very thin, and there's not much like fat, you know, that's in that area. So really just going right right in the subcutaneous dermal border, and it's almost like a TB injection, very small, and just putting little aliquots. Again, you're not going too far at all. It's so thin. When you pinch out, the most important thing, like I was saying, to see is that when you're pinching it, you see a little tent over here, a little edge. That's
Right.
So we'll do that again here. Doing great. And then that's it. You can see it flow as we go. No questions from the audience, huh?
Anybody, any questions about the technique or how we're doing things or anything like that? No, I think
You're doing
you're doing a
great.
great job explaining it.
I guess so.
Clear.
It's either really good or really bad.
And this is a conservative treatment. Don't forget the study. Some of these people are getting 1.5, 2 syringes per hand. We're doing, we're doing 1 syringe per hand, and we're getting nice, visible results.
Yep, exactly. So I'm gonna have you fill that one. We'll do a light pressure, very light. And then the big wow will be at the end when we compare both, put both next to each other. We're almost done, just a couple more minutes. Some of this is swelling. It will all balance out. Okay, good. Okay, half left. Continue. Now flex your fingers again so we can see. Flex them up. There you go. Yeah, it's already good. Okay.
Yeah, one small point that I wanted to raise is that in the study and here in the demonstration as we're injecting, we told the patient to remove any rings on her fingers, just in case afterwards if there's swelling, that doesn't cause any problems. So that's something that I would recommend that everybody else does as well. When you're doing injection of the hands, just have the patient remove the rings from their fingers.
And it would be good if they're to not put on the jewelry again until all the swelling subsides. That's sort of the important point with jewelry on the hands. Everywhere that we want it to go, and then we'll do a light massage, and then we'll compare the other side. Almost there. You can see